I am Dr. Lloyd Nazareth, Group CEO, American Oncology Institute, based out of Hyderabad. At any given moment in India, we have approximately 4 million cancer cases who are under treatment. Every single year, the new incidence of reported cancer is approximately 1 million new cases per year. And we do firmly believe that at least 25 to 30% of actual cancer cases go underreported. There is an alarming trend and a disturbing trend of increased incidence, and as per our own projections, we believe that by year 2020 or 2021, the incidence of reported cancer per year in India will reach as much as 2 million new cases every single year. India has currently about 250 cancer treatment centers. That is about 0.2 center for every million population. In many countries in the developed world, you have as many as 4 centers per million population. So India is a severely underserved country as far as cancer treatment centers are concerned. There is also an impending crisis as far as trained manpower is concerned. India has only about 1,500 trained oncologists. So to put it in a nutshell, India needs to treble its infrastructure and probably quadruple its trained manpower if we want to meet the impending crisis of 2020 to 2021. So in every field of cancer care, there are very interesting advances taking place, whether it's surgical oncology, medical oncology, radiation oncology, bone marrow transplant, etc. In India, probably only 15% of the population have an annual income more than the baseline cost of treatment of a cancer. In other words, 85% of our patients still find it difficult to afford proper or adequate cancer care. In some of the states, particularly in the south, government has chipped in by making and giving subsidy to some of these patients and making cancer care affordable to people below the poverty line and even the lower middle and middle income groups. But there's still a long way to go. If we really want to make cancer care affordable, we probably need government support to be provided to at least subsidize a large part of cancer treatment cost. Obviously, across surgical, medical and radiation oncology, a number of advances are taking place in treatment of cancer. Probably one of the most exciting areas is in the area of medical oncology. There are new innovative treatments coming out. There are targeted therapies where chemotherapy drugs are being tagged onto monoclonal antibodies, allowing very targeted therapy where the chemotherapy drugs only attack those cells affected by cancer. We also have areas like immunotherapy, where huge advances are taking place, and probably many more will take place in the future. And immunotherapy is proving to be useful in treatment of skin cancers, certain types of breast cancers. Now it's being used for some types of lung cancers, pancreatic cancers, and this is an area where we see a lot of advances taking place in the future. Probably in the future, we will see something in the area of genetic sequencing, where every tumor will be treated as unique. And once the DNA profiling of the tumor is known, then therapies will be targeted to treat each patient and each type of tumor in an individual manner, sort of a personalized cancer care. American oncology had its origin in a hub and spoke model in Western Pennsylvania. About 6 years back, we planned to make an international foray and decided to come to India because the language was common. Second thing, India had excellent clinicians and India had a working legal system. We started our first hospital in Hyderabad, which has grown over the last 3 to 4 years to be one of the major cancer treatment centers in Hyderabad. As a group, we have the vision and mission to provide university level care to patients in third world countries, which are on par with the care that patients access in the developed world. We believe that to provide proper cancer care requires a multidisciplinary collaborative approach to the patient, and therefore we insist that our doctors take part in tumor boards where the case is discussed between the surgical, medical and radiation team. We also every week hold an international tumor board where our doctors discuss cases with an international panel based out of Pittsburgh and discuss complex cases. So finally, the end result is that patients get the best evidence-based treatment that is possible. The second area that we've tried to create a differentiator is in centralized treatment planning. Today, most of our patients, regardless of where they are being treated across India, will have their treatment planning done out of a central location based out of Hyderabad. Trained medical physicists will do the treatment planning for every single case in a controlled environment under mentorship of a team based out of the US. This is very important to provide precise radiation care for our patients. The third area that we are trying to be different is to insist that all of our doctors do not follow their own personal impressions in treatment of patients, but actually follow evidence-based care pathways, evidence-based decision support systems, and protocol-driven care. We've also spent a lot of time and energy in providing training in both medical oncology and management of patients to our nurses. American Oncology currently has a major center based out of Hyderabad. Recently, we've launched a center based out of Vijayawada, Guntur, which is the new capital of the Andhra state. Shortly, in the next 3 months, we are opening centers in Ludhiana, in Nagpur and Coimbatore. By the end of 2017 calendar year, we have hoped to have about 7 to 8 centers functional across India and South Asia. Over the next 3 to 4 years, our ambition is to have about 20 to 25 cancer centers functional across the entire South Asian region. Probably about 6 of these centers will be based in Sri Lanka, Myanmar, Bangladesh and Nepal, and the rest will be based in India. In most of our centers, which are major hubs, we hope to have a complete service offering of surgical, medical and radiation oncology facilities. In some of them, we will even have comprehensive bone marrow transplant facility. In most of our major hub centers, we hope to have differentiation across the specialties. In surgical oncology, we hope to have site-specific expertise offering head, neck, breast, thoracic, GI and uro-oncology expertise. Similarly, in the area of medical oncology, we hope to have different people treating pediatric patients, adult patients, hematology patients, etc. The incidence of cancer care is going to double from current 1 million reported cases per year to 2 million reported cases per year over the next 5 to 6 years. The incidence of cancer cases are going to increase from 1 million reported cases per year to about 2 million reported cases per year over the next 5 to 6 years. It is therefore imperative that we have concrete plans to at least treble the amount of infrastructure available for treatment of cancer and quadruple the number of trained clinicians to be able to handle this impending crisis.